Medical Tourism Corporation interview with Dr. Anand Khakkar, Liver Transplant Specialist. Dr. Khakkar has extensive experience in India and internationally.
My name is Dr. Anand Khakkar. I'm basically a surgeon. I specialize in liver and hepatobiliary surgery, and my particular area of interest, where I also obtained my fellowship training, is in transplant surgery. And my current focus is on liver and pancreas transplant, particularly living donor liver transplant as well as cadaveric liver transplant. And we have set up a department here called the Center for Liver Diseases and Transplantation, which is a multidisciplinary group of physicians, surgeons, and all the doctors that participate in the care of patients with complex liver, biliary, and pancreatic diseases. I did my basic education, MBBS, that is general surgery, as well as super specialties in India, Gujarat, and in Tamil Nadu. And then I went on to do an American Society of Transplant Surgeons accredited fellowship in liver and multi-organ transplantation at the University of Western Ontario in Canada. Subsequently, I spent a couple of years doing another fellowship in living donor liver and pancreas transplant at the University of Pittsburg. I worked with Dr. Starzl, the pioneer of liver transplant. And then I served a short stint of about a year and a half as a faculty in Columbia University in New York as a transplant and hepatobiliary surgeon. We started this department here at Apollo Hospitals in Chennai last year, and has been a great experience of initiating a department and starting off whatever I learned there. And I would say we have a modest beginning. We have done about 7 liver transplants here, and we have had 6 more livers where we took the livers to Delhi and we transplanted them there. So in about total 13 in just over a year since we started actually. And we are also doing living donor liver transplants now here. And has been exciting times for me to be able to make a difference here. Love my job. Of these 13, there were 2 patients from abroad, and we have 2 more living donor liver transplants for foreign nationals coming up in the next 2-3 weeks. So yeah, we do a fair bit of foreigners in the program here, although still a larger majority are Indian nationals. Now, I have the advantage of directly comparing what I saw at Pittsburg and New York and in Western Ontario to here, and I would say that it is very comparable. In fact, because we are a little more conservative than what we used to be in Pittsburg, currently I would say our results are better than what I saw in Pittsburg, basically. It's partly because we are a little conservative. We use very safe and good livers only, and Pittsburg being Pittsburg, they take a lot more risk on both the donors and recipients, and consequently their results are sometimes affected by those attitudes. But I would say overall, for the last between the Apollo group of hospitals, our results for about over 100 livers for the entire group was 87%. So which is very comparable to Pittsburg, was something like 82-84% in that range. So it's very comparable. I wouldn't really say that it's better or worse, but it's almost the same. I remember when I was in US and Canada, and we used to talk about people going to Eastern, particularly Asian countries for medical treatment. There used to be a lot of skepticism, and that was mainly related to the fact that people didn't know too much about India. They had their doubts regarding the availability of adequate technology, hygienic measures, whether the doctors and nurses there would have the same concepts regarding infection control, and whether the medicines and the instruments and the technical infrastructure would be comparable. But having worked there and working here now, I really have no deficiencies at all. I have the same infrastructural support as well as manpower, technically trained manpower support, and that is the reason why I continue to work here, over and above the fact that this is home for me. I'm here because I'm even professionally just as well taken care of in terms of availability of infrastructure, availability of instruments, trained nurses, coordinators, I mean, once you are inside the hospital, practically you wouldn't really know whether you are in the US or you are in any other country. They're essentially the same facilities, and it always helps to get the transplant faster wherever you are in the world, in the US or even in Italy, Spain, or in India. Waiting for a cadaver organ always involves delay of time, depending on whether they have cancer or not, and the liver as a complication of cirrhosis. They may need to use bridging therapies if you don't have a living donor right away. So there is a certain disease severity score which is called the MELD score, and usually whoever is listed in the US will know their MELD score, because the institute or the organ procurement organization will inform them about the status on the waiting list and the MELD score. So anything that is more than a MELD score of 20 essentially carries a significant risk while waiting. And for all these people, I would recommend that if there is a potential living donor within the family, then they should actively consider living donation in order to expedite their liver transplantation. So being the two of us, the advantage is that there's not one person doing too many things. We are always available for each other. We always give each other a break. You get a surgeon who is always adequately rested, well prepared, and adequately backed up in case of difficult times, which are very common in these kind of major undertakings. Even post-operatively, one of us is always available over and above the support staff. One of us is constantly available and present for taking care of the patient. Also, during the transplant surgery, one of us will be attending to the donor surgery, while the other would be attending to the recipient surgery, essentially allowing us to overlap, so that reduces the cold ischemia time. The cold ischemia time significantly matters as relates to the outcome of the surgery. So I think having the two of us is very critical, and I think it's very important that you choose a team which has at least two two surgeons who work with each other in synchrony and are capable of handling the whole thing by themselves entirely. That's a huge advantage. I would say that that's a very strong plus in our program.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.